Hello, I'm Michelle Becker here to talk with you about psychological safety and ethical issues with my partner, Shelley Betancourt. She's a women's health nurse practitioner, and I'm an OB-GYN doctor. These issues are near and dear to our heart, and we wanted to share some information with you that we think will be helpful for you and your team. So first, we need to give you a disclaimer. And this presentation is not intended to address professional liability or legal issues arising from decision making. Seek legal advice when certain concerns arise. We have objectives for our audience members to better understand their role in psychological safety in the healthcare system they work, to name safety issues found in every healthcare unit, breaking through organizational silence. I'm not the boss. What can I do to create psychological safe workplace? We're going to give you some tools for these objectives today. So we're really excited to get you through this. By definition, psychological safety is broadly defined as a climate in which people are comfortable expressing and being themselves. More specifically, when people have psychological safety at work, they feel comfortable sharing concerns and mistakes without fear of embarrassment or retribution. When work environments have reasonably high psychological safety, good things happen. Mistakes are reported quickly so that prompt corrective action can take place. Seamless coordination across groups of departments is enabled, and potentially game-changing ideas for innovation are shared. In short, psychological safety is a crucial source of value creation in organizations operating in a complex, changing environment. And boy, isn't that what we have, a complex, changing environment. There's a great quote from Johann Wolfgang von Goethe, and it says, "Treat people as if they were what they ought to be, and you help them to become what they were capable of being." So how are you attending the meeting? And there's definitely different attendees. So are you the explorer, a shopper, a vacationer, or a prisoner? So what I'd like you to do is, if your moderator can give you a sticky note and you write either E, S, V, or P, depending on which of these that you think you are, on the sticky note, and then pass it back to the moderator. So the explorer is someone who's eager to discover new ideas and insights. You want to learn everything you can. So you would write an E on your sticky note. Shoppers, they look over all the available information that we have to offer, and you're going to be happy if you go home with one useful idea. So you would write an S on your sticky note. Vacationers, they're not really interested in the work, but they're happy to be away from the daily grind. And we know there's some vacationers out there, so put a V on that sticky note if it's you. And then prisoners. They feel as if they've been forced to attend and would rather be doing something else. So we're glad you're here, and hopefully you'll get something from it, even if you feel like you're a prisoner. But write a P on your sticky note if you are. And then we'll come back around to discuss that further. There's another way we can go about looking at psychological safety, and this is a poll. So get a second sticky note, and on here, you write which number best applies to you. So you would write 5 if this is you in regards to work. Hey, no problem, I'll say anything. If this is you, I'll say most things, but a few things might be hard to say, then you would write a 4. If at work you'll share some things, but keep a few things to yourself, then you would write 3 on your sticky note. You write a 2 if this statement is you. I'm not going to say much. Mostly, I'll let other people bring up issues. And then write a number 1 if you smile and claim everything is great and agree with whatever the manager says. And so write that on your second sticky note, pass that back to your moderator, and again, we'll come back to these issues in a bit. So managing disruptive behaviors. The Joint Commission has called for healthcare organizations to formally manage disruptive behaviors and build positive partnerships to improve patient outcomes and experience. They're an integral part to making this successful. Understanding organization silence and breaking through the silence is integral. Understanding the second victim phenomenon and supporting the second victim in a poor outcome to help with healing is a very strong issue that we need to address. Dispelling disrespect and obtaining a just culture. A just culture is a really important aspect of your daily work. Responsibility fatigue and mental injury. a burned out feeling that arises from having too many obligations. And realize responsibility fatigue comes before burnout. The worker fatigue is part of a costly and dangerous cycle that results when workload, staffing imbalances exist. Understaffing leads to increased overtime, fatigue, staff burnout, and turnover. When healthcare workers are fatigued, the safety of both patients and staff is compromised. This presentation will help you and your team bring discussions back to your facility. Opening closed ears, removing those organizational constipators that are out there. Organizational constipators don't believe that resources should be allocated for time and education to develop essential skills because of the mistaken perception that relationships among healthcare team members do not affect an organization's financial health. Work environments that tolerate ineffective interpersonal relationships and do not support education to acquire those skills and to prevent them, they're perpetuating this constipation. Relationship issues create serious obstacles to the development of work environments where patients and their families can receive safe and achieve optimal outcome. It's what we want. We want optimal outcome for our patients. Inattention to these relationships creates barriers that become the root cause of medical errors, hospital-acquired infections, clinical complications, patient readmissions, and nurse turnovers. So why the attention? Why do we have the attention here? And the why is answered because you need to bring your brain to work. Some cannot always contribute what they know at that critical moment, but in most workplaces, people are holding back way too often. And psychological safety is a part of allowing this to open up and to flower. The single biggest problem in communications is the illusion that it has taken place. Statistics are out there, and you can show statistics about many things. This Gallup poll in 2017 found that 3 out of 10 workers strongly agreed that their opinions count at work. What would happen if this moved to 6 out of 10? There would be a 27% reduction in turnover, a 40% reduction in safety incidences, and a 12% increase in productivity. This is why it's not enough for leaders to simply hire talent. Any plans to look ignorant at work today? What? Who would want to look ignorant at work, right? So to not look ignorant, you don't ask questions. You don't want to look incompetent, then you don't admit to mistakes or weaknesses. You don't want to be disruptive, so you don't make suggestions. The AACN's critical nurse care work environment surveys demonstrate that collaboration with physicians and administrators is among the most important elements in creating a healthy work environment. Respect between nurses and physicians for each other's knowledge and competence, coupled with a mutual concern that quality patient care will be provided, is a key organizational element of work environments that attracts and retains nurses. Additionally, an unresponsive bureaucracy generates organizational stress. We all know it, which is significantly more predictive of nurse burnout and resignations than emotional stressors inherent to the work itself. So VUCA, I want to introduce you to VUCA if you have not heard of this before. This is an acronym, and its issues are all within any business, and psychological safety is directly tied to the bottom line. This is because employees' observations, questions, ideas, and concern provide vital information about what's going on within the business. And to add to the growing emphasis on diversity, inclusion, and belonging at work, it becomes clear that psychological safety is a vital leadership responsibility, and it will make or break an employee's ability to contribute, grow, learn, and collaborate. So VUCA, the volatility, these are changes that occur more and more often than before and require continuous analysis and evaluation. Uncertainty, we're not able to unambiguously predict and prioritize factors that may influence the situation. The complexity of a situation, there's a number of factors that determine or influence the development or processes increases significantly. All of the factors are unknown to us. Ambiguity, data and events are difficult to interpret unequivocally. Past experience is not applicable to explain new processes and events. Boy, does VUCA ever talk about COVID, right? That's definitely some issues that were complex, volatile, uncertain, and ambiguous. So touching back on this AACN, or the American Association of College of Nurses, there's standards for establishing and sustaining healthy work environments. And there's 6 skills that they have here. Skilled communication is the first. Nurses must be as proficient in communication skills as they are in clinical skills. And I agree, I think this also needs to be physicians. True collaboration, nurses and physicians must be relentless in pursuing and fostering true collaboration. Effective decision-making, nurses must be valued and committed partners in making policy, directing and evaluating clinical care, and leading organizational operations. Appropriate staffing, staffing must ensure the effective match between patient needs and nurse competencies. Meaningful recognition, nurses must be recognized and must recognize others for the value each brings to work at the organization. Authentic leadership. Nurse leaders must fully embrace the imperative of a healthy work environment, authentically live it, and engage others in its achievements. There's a quote by Robert F. Allen. People will not believe in an organizational change effort unless they have the opportunity to plan it, experience it, provide feedback, and own it. Involvement supports and sustains motivation, the essential ingredient for change. With this quote, I really recommend that you get involved. You help with this organizational change and put the effort forward. There's a triad of psychological safety: candor, transparency, and learning from error. Candor, we ask questions compassionately. Transparency, this may even involve videotaping meetings to archive and allow others to watch. Learning from error and allowing failure, but realize failure a second time is not acceptable. So this is the triad: candor, transparency, and learning from error. There's a psychological safe culture we want to go through. And we know that people speaking up is part of that, asking questions, debating vigorously, committing themselves to continuous learning and improvement. Good things happen. It's not always easy or enjoyable. And investing the effort and living with the challenges pays off. This is what Pixar calls brain trust. So we invite participation. We invite people from the front line. Ideas do not succeed without buy-in, and we want you buying in. It's not always obvious, and there's nurturing the participation. So top management spending time and having good sense to realize when the ideas won't succeed. Frontline workers will have to be implicitly involved in the designing process. And working in a fearless organization does not imply more time or effort is needed for a tremendously difficult journey. But initially, when we haven't been entrenched in fear and its attendant mental framework, it's not always obvious. There's endless examples of how even brief verbal exchanges can be thwarted by a lack of psychological safety. The nurse fails to speak up about a possible procedure area to the surgeon due to past exchanges that led him or her to think this would bother them. The new engineer on a project who doesn't question because he or she fears looking stupid. The boss who doesn't listen to ideas from employees because he or she thinks it will make them appear weak. You are called upon to contribute your best to the company. Likewise, the company is responsible for helping individuals develop and succeed. And that leadership development, there's programs that emphasize on management and team skills along with quality improvements, communication across boundaries and through well-established medical hierarchies, issuing information rather than orders. Speaking up is not a natural act in hierarchies and it must be nurtured. So setting the stage, there's framing the work with leadership, and that change from using the word investigation into study. So you're not really investigating something, you're studying it. Instead of error, can be failure or accident can be used. These different changes in words just change the connotation. Frames consist of assumptions or beliefs that we layer into reality. Why do we do this automatically? But we do. Realizing system complexity is the issue, not incompetence. Ask the question, was everything as safe as you would like it to have been this week with your patients? A genuine, curious question. And then responding productively. Speaking up is only the first step. The true test is how leaders respond when people actually do speak up. Productive responses must be appreciative, respectful, and offer a path forward. Consider a focused event analysis or an FEA. You meet, you explore, you identify factors, and you respond productively. Reminding people human life is on the line helps put personal thoughts aside. People are more likely to speak up and overcome inherent asymmetry of voice and silence if leaders frame its importance. How people see bosses presents a crucial area for reframing. Eric Klein has a quote, "Authentic leadership is determined neither by your position nor your title, but by the depth of awareness, skill, and presence you bring to your actions and your interactions." It takes courage. It is possible to agree that this is needed with assertions. Because, let me start that slide over. Courage. It is impossible to agree that this is needed with assertion. Exhorting people to speak up because it's the right thing to do relies on ethical arguments, but is not a strategy for ensuring good outcomes. For speaking up to become routine and expectations about speaking up to become routine, this must become institutionalized and systematized. Insisting on acts of courage puts the onus on individuals without creating the conditions where the expectation is likely to be met. We want to avoid people erring on the side of silence, implicitly favoring self-protection and embarrassment. Avoidance over the possibility that one's input may be desperately needed in that moment is a serious risk factor. It is clearly far better for people to question and ask them or raise concerns and be wrong than it is for them to hold back. Most people do not consciously recognize that fact. A culture of listening is needed. Consider making it a requirement to write these things down. Individual mistakes, strengths, weaknesses, or pain buttons, which records the employee's reactions to specific criticisms as well as their changes in behavior to remedy that weakness, and whatever the changes were effective. So listening is definitely key, and we need to avoid that silence. Transparency libraries at Bridgewater is something to consider at your facility. Prohibition on talking about people who are not present and thus cannot learn from what's being said. We call them slimy weasels. That's your name if you talk behind someone's back. Managers are not to talk about supervisors if they're not in the room. Assessment statistics are kept on all what they call a baseball card at Bridgewater, and they're publicly available to everyone in the firm. This is issued by managers for making decisions around compensation, incentives, promotions, and firing. No one can hide behind transparency. A transparency library contains videos of every executive meeting, and it's available to view in case the employees want to see how the policies or initiatives were discussed. Another example of people speaking up, Uber's sexual harassment was uncovered. There's something really important here. We know that people can be empowered by standing up for what's right. Words can change the world. Susan Fowler helped expose the problem that we'll no longer be silenced, giving us all a chance to ask ourselves, how am I a part of this? How do I fix it? And not ask until we have solutions. There's a fearless organization. A truly fierce workplace may be impossible. In the eyes of peers and bosses, people are naturally averse to those and lose their standing. Nonetheless, a growing number of organizations are making the fearless workplace an aspiration. Leaders of these organizations recognize that psychological safety is mission critical when knowledge is a crucial source of value. It is. Your knowledge is that crucial source. In that sense, a fearless organization is something to continually strive for rather than to achieve once and for all. It is never ending and it's a dynamic journey. Reframing. Reframing is a big part of what can lead us to a different arena and to more psychological safety. The leader is obligated to set direction for the work, to invite relevant input and clarify and improve the general direction that has been set and create conditions for continuing learning to achieve excellence. So you can look at the default frames where the boss has the answers, the boss gives the orders, the boss assesses performance. And the others, they're subordinates who must do what they're told. Now, if you look at the reframe on the right, the boss sets directions. Let me restate that. On the reframe on the right, the boss sets the directions. She invites input to clarify and improve. He creates conditions for continued learning to achieve excellence. And then others, they're contributors with crucial knowledge and insight. And so leaders in this VUCA world that I spoke of earlier, the volatile, uncertain, complex, and ambiguous world we work in, most consciously reframe how they think. And the default frames we all bring to work unconsciously to a more productive reframe. Framing the work is not something leaders do once and it's done. Framing is ongoing, calling attention to levels of uncertainty, attention to interdependence, and how people must be alert and candid to perform well. And notice the default frames on the default set, these are interpersonal, this makes interpersonal fear sensible. In the world where the boss has all the answers and absolute authority over how your work is judged, it makes sense to fear the boss and to think very carefully about what you reveal. On the right, the reframe is in contrast and spells out logic that clarifies the necessity for a psychological safe environment. The logic applies to the successful execution of work in most organizations today. So setting the stage, motivating effort, inviting people so they feel compelled and genuine, using humility, and understanding power. So motivating an effort, it's the leader's job to bring people to a psychological safe place where they are in touch and how they can work matters. Motivation is key. Motivating the people by articulating compelling purpose is a well-established leadership task. Leaders would be well served by stopping to reflect on the purpose that motivates them, and this makes the organization's work meaningful to the broader community. How often do you convey this compelling rationale for the work to others? Our primal need to feel purpose and meaning in our lives, including at work, has been demonstrated by numerous studies in psychology. Inviting people so they feel compelled and genuine, the second bullet, this is an essential activity. Inviting the participation in a way that people find compelling and genuine is key. The goal is to lower what's usually too high of a bar for what's considered appropriate participation. Realizing self-protection is natural. The invitation to participate must be crystal clear that people are going to choose to engage rather than to play it safe. 3 essential behaviors need to occur from the leader: adopting a mindset of situational humility, engaging in proactive inquiry, and designing structure for input. Humility, the bottom line is no one wants to take interpersonal risk of imposing ideas when the boss appears to think he or she knows everything. On the other hand, a learning mindset which blends humility and curiosity mitigates the risk. A learning mindset recognizes that there is always more to learn. Adopting a humble mindset when faced with complex dynamic uncertainty in the world in which we work today is simply realism. Situational humility, since the need for humility lies in the situation. Another term, here and now humility. Humility is the simple recognition that you don't have all the answers and you certainly don't have a crystal ball. The research shows when leaders express humility, teams engage in more learning behavior. This has included acknowledging your errors and shortcomings. Rather than offering an uninformed opinion, replying with "I don't know" to questions that can be key. The willingness to be vulnerable with others and admit shortcomings can be an asset. Instead of people losing confidence, they gain confidence in you when you don't know something. Others can then offer up their expertise and engage in the process. Although this may seem downright obvious, such humility can be strangely rare in some organizations. I bring this up because this doesn't only apply to you and your managers, this applies to you and your patient care techs. It applies to you and your patient. You're the physician, it applies to you and your administration, to you and your managers, to you and the nurses you work with, and your patients. So having this humility is really key. The last is power. Power can cause leaders to become overly obsessed in outcomes and control of those outcomes. People's fear of not hitting targets, fear of losing bonuses, fear of failing. And as a consequence, they strive to experiment and to learn is stifled. Being overly certain or just plain arrogant can have similar effects, increasing fear, reducing motivation, and inhibiting interpersonal risk-taking. I'm going to start that power one over. Power is our last bullet. It can cause leaders to become overly obsessed with outcomes and control. People's fear are an issue. Fear of not hitting targets, fear of losing bonuses, fear of failing. And as a consequence, their strive to experiment and to learn is stifled. Being overly certain or just plain arrogant can have similar effects. Increasing fear and reducing motivation inhibits interpersonal risk-taking. I'm going to hand it over to Shelley Betancourt for the next section. This section, we talk about the mini reward of thanks and expressing appreciation. Thanking the person when they speak up. It doesn't matter what the nurse thinks when the CNA speaks up. A response of appreciation, feedback, and explaining the clinical subtleties. The courage to speak up must receive the many rewards of thanks. Also, the situation when a nurse speaks up to a physician about having missed something. A response that expresses appreciation, such as, "Thank you so much for bringing that up," allows the nurse to feel psychologically safe. It doesn't matter that the doctor believes or doesn't believe what he or she has said is relevant. The physician's initial response must be one of appreciation that he or she can then educate. This gives feedback or explain this clinical subtleties. I'm going to start this slide over. Expressing appreciation with many rewards of thanks is our next section. Thanking that person when they speak up is huge, whether that involves a nurse with a physician, a nurse to a CNA, whichever the response, the appreciation needs to occur. And then feedback and explaining clinical subtleties. I'm going to start over again. This next section discusses the mini reward of thanks, and it real, again, take 5. This next section talks about the mini reward of thanks and expressing appreciation. Thanking the person when they speak up. This is really important. It doesn't matter what you think the person is bringing up to you is correct or incorrect. What's more important is that response of appreciation. Whether it's the nurse speaking to a CNA when a CNA has a concern, if it's the physician to a nurse to the physician, that feedback and explaining clinical subtleties can come after that appreciation is spoken. And so the situation where a nurse speaks up to a physician about having missed something, a response that expresses appreciation, such as "Thank you so much for bringing that up," allows the nurse to feel psychologically safe. It doesn't matter what the doctor believes. The physician's initial response must be one of appreciation that she or he can then educate. That is, give feedback or explain those clinical subtleties. But to ensure staff speaks up and to keep patients safe from unexpected lapses in attention or judgment, praising people for their efforts, regardless of the outcome, is key. Good outcomes are not always the result of good processes and vice versa. So we need to have each other's back, essentially, and listen to what people are bringing up. Failures. The biggest fear is not hearing about failures. The intelligent failure the first time is no longer an intelligent failure the second time. The primary result of responding to failures in a negative way is that you're not going to hear about them. And that should be your biggest fear. Small failures, they're the currency for subsequent improvement. A productive response to prevent failures is to double down on prevention, usually a combination of training and improved system design to make it easier for people to do the right thing. Firing someone may be the appropriate response. Will this kill psychological safety? Most people are thoughtful enough and appreciate that when people violate the rules or repeatedly take risky shortcuts, they're putting themselves, their colleagues, and their organization at risk. In short, psychological safety is reinforced rather than harmed by fair, thoughtful responses to potentially dangerous, harmful, or sloppy behavior. When humor is not funny. People who say, "Just kidding." People need new skills to respond to these just kidding moments until it becomes an acceptable. Sorry, let me start that over. When humor is not funny, the "just kidding" phrase People need to have new skills to respond to these just kidding moments until it becomes unacceptable within the organization's culture. A suggested response would be, wow, that felt super inappropriate. Can we have a do-over? So here's an example. A female coworker asks, can you stay late today and work on a project with me? To a male coworker. He responds, I will if you sleep with me. And then just after a beat, just kidding. It sounds like a bad joke because it really is a bad joke. When someone feels the need to add this tagline, just kidding, after a comment, it probably meant the person knew the comment was at the risk of being unwelcome and inappropriate. People need new skills to respond to this just kidding moment until it becomes unacceptable within the organization's culture. A suggested response would be, wow, that felt really super inappropriate. Can we have a do-over? And ideally then, you would respond in a more positive way. And hopefully that would then percolate through the organization until eventually those just kidders would begin speaking appropriately and inclusively. These bottom-up changes are most effective when they are accompanied by clear cultures with directives set by leadership. Do the right thing, period. Change, it is possible. But when they talk too much, if we allow the voice to be heard, let me start that one over. Change, it is possible. If we allow their voice to be heard, though, will they talk too much? It may be hard work, but cultures can and must change if organizations are to thrive in a knowledge-intensive world, those VUCA worlds we've been talking about. A concern can there be too much psychological safety? Will releasing the brake on voice cause people to talk too much? Uninformed, unhelpful comments derail projects? Good ideas get lost in a sea of chatter? Will people be sloppy? No, you can't have too much psychological safety, but you can lack discipline. So psychological safety is about reducing interpersonal fear, making it heroic to ask a question or to admit an error. It does not mean that you automatically have a good strategy for getting the work done. It does not mean your employees are sufficient and motivated or well trained. So psychological safety is important, but the discipline behind it is much more important as well. And understand, as humans, we spontaneously set an invisible threshold that governs when people speak up and what they speak up about. We err on the side of holding back information or questions, even when we believe that they might matter, that they might have the potential to add value. In fact, it's rare to find people err on the side of voice. Is it possible for the threshold to be set low, unleashing all kinds of unhelpful or inappropriate voice? This occurs less often than what you might expect. So the risk of excessive voice is not addressed. So the risk of excessive voice is not best addressed by reducing psychological safety, but rather providing feedback to give the speakers insight into the impact she or he has had. Psychological safety makes it possible for the other drivers of success, like talent, ingenuity, diversity of thought, to be expressed in ways that influence how work gets done. How will we get anything done if people are always talking? Psychological safety adds explicit attention to time and efficiency. Mirroring the concern about a low threshold of voice is the concern that meetings will go on because everyone must have his or her say. Numerous tools are available to run efficient meetings. Not any one of these are at odds with establishing a climate of candor where they're able to focus on the task rather than on face-saving and self-protection. Often the psychologically safety can often save time rather than consume time. Let me restate that. Often psychological safety saves time rather than consuming time, and is often a source of efficiency. For instance, with a lack of psychological safety, long-winded conversations because of indirect statements with veiled criticisms and personal innuendos take longer than candid ones, and they occur with elongated meetings and an inability to come to a resolution about crucial strategic issues. In short, the lack of psychological safety can be deeply inefficient, stretching resolutions from hours into months. Working with teams with clear processes combined with direct and open dialogue provide efficient, smart conversations where clear decisions will save time. Work relevant input is needed. Wanting to discuss coworkers' presentation style is not relevant. Let me restate that last sentence. Work relevant input is needed. Wanting to discuss a coworker's presentation style is not relevant. So here's a series of questions for you. So you're not the boss, but what can you do to create a psychologically safe workplace? And so we're going to go through some questions here. So asking a good question and being motivated by genuine curiosity or by a desire to give someone a voice, those questions create a vacuum that serves as a voice opportunity for these others, especially when the question is direct and an individual in a way that conveys curiosity, creates a small safe zone automatically. So asking the questions conveys, I'm interested in what you have to say. In doing so, it allows one or more of others to offer their thoughts and speak up. So with or without asking a question, you can create psychological safety by choosing to listen actively to what people say and by responding with interest and then building on their ideas or giving feedback. True listening conveys respect and in a subtle but powerful way reinforces the idea that the person's full self is welcome here. No, this does not mean you have to agree with what's being said. You don't even have to like it. What you have to is appreciate the effort that it took. Another helpful practice is to frame the challenge you see at hand. Reminding the people of what the team is up against. Discuss how the work is uncertain, challenging, or interdependent. This helps to frame reality in a way that emphasizes no one person is supposed to have all the answers. This lowers the hurdle for speaking up. It reminds people that their input is welcome because it is needed. If a few simple phrases that are uncommon and powerful that anyone can utter to make the workplace feel just a tiny bit more psychologically safe, wouldn't you speak them? Let's see what they are. I'm going to start this slide over. There are a few simple phrases that are uncommon yet powerful that anyone can utter to make the workplace feel just a tiny bit more psychological safe. A few of them are here. I don't know. I need help. I'm going to start over this slide again. There are a few simple phrases that are uncommon yet powerful that anyone can utter to make the workplace feel just a tiny bit more psychologically safe, such as, I don't know. I need help. I made a mistake. I'm sorry. These are all expressions of vulnerability. By being willing to acknowledge that you are a fallible human being, you give permission to others to do likewise. Shape the climate, even if you are not the boss. These words of interest and availability are powerful. Questions like this: what can I do to help? What are you up against? Share with me some of your concerns. The personal challenge for all of us lies in remembering, in the moment, to be vulnerable as well as interested and available. To do this involves a small interpersonal risk because your attempts may be ignored or worse, rebuffed. Experience shows the odds are low and more likely these questions will be well received. David Thomas. Individuals and organizations learn and evolve through conscious, deliberate action. Deliberate action is ethical. When the time to act has come, that's unethical not to do something.